Fox 31 Denver, News at 9.
Hey, one of the best ways to treat a mental health issue is to understand it.
It can be life-saving for patients because you can save years of patient suffering from incorrect, ineffective medications.
Coming up, how a Denver area clinic is using new technology to diagnose mental health disorders, including ADHD.
Anyone who struggles with depression, ADHD, or other mental issues knows getting the right diagnosis and treatment can be a rather frustrating process. Now, Fox 31's Melody Mendez shows us how one Greenwood Village clinic is using a new technology to read patient brainwaves and get more clear-cut answers.
Kat Kubat was diagnosed with ADHD at just 9 years old.
All through grade school, it is something that I fought and dealt with. And then in high school, I actually got to the point where I was frustrated.
For years, Kat struggled with medications and finding the right treatment for her ADHD. And like many patients with mental health issues, it was a roller coaster ride that went on for years. Now at 32, she's back on medication for attention deficit disorder.
There is a lot of gray area around diagnosing ADD and ADHD.
Different patients can have the same symptoms but for different reasons. And sometimes giving a diagnosis based on symptoms alone can be a misdiagnosis.
So Dr. Nicole Shadid and the medical professionals here at the Neuro-Therapy Clinic in Greenwood Village are taking a more objective approach with this machine. They use an EEG to look at brain waves, much like an EKG does for the heart. They record the brain's electrical activity and use that to help diagnose everything from ADHD to depression and many other mental health issues.
This allows us to understand a patient's unique brainwave patterns.
It's a simple office-based procedure where patients are in a relaxed but awake state. They put on what looks like a swimming cap with electrodes. It takes about 20 minutes.
So we can actually look into the brain and see what's going on, rather than just randomly trying a medication and seeing if it works.
And just like an X-ray allows doctors to see a broken bone, the EEG gives doctors a snapshot of what's happening inside a patient's brain.
With this, it is so... it's black and white. You can see this is a definitive diagnosis.
Now, this process helps not only with diagnosis, but with the next two integral steps, treatment and medication. Doctors submit these images gathered from the EEG to a database called Peer Online. It's a shared resource developed by physicians across the country over the last 20 years.
It allows us to compare and learn which medications have been effective, as well as which medications have not been effective for physicians treating patients with similar EEG findings.
Minimizing the frustrating trial and error process.
It can be life-saving for patients because you can save years of patient suffering from incorrect, ineffective medications.
They can basically say this is what you have, and this is what will essentially fix it. That to me is mind-blowing.
Melody Mendez, Fox 31 Denver.
The whole process costs about $750. The test is not covered under insurance, but that could be changing soon. Health insurers are very interested because getting patients on the right meds sooner means saving money.
Frontier Airlines